Welcome to our educational video series for joint replacements. If you're watching this, that means that you've decided to move forward with having either a hip replacement or a knee replacement for me. And before we get going, the first thing I would like to say is thank you. If you are trusting me with your surgery and trusting me to help you get back on your feet and improve your activity levels, that really means a lot to me. I know that there's a lot of other surgeons who would be able to do this, and the fact that you've chosen to have me do it means a lot to me. It's a responsibility I take very seriously. And that's why I've made these videos. I want to make sure that I've assembled all of the information that I think is most relevant for this surgery so that we can educate you and give you all of the tools you need to have a successful outcome and make a good recovery from this surgery. So I'll be going through a lot of information here that I think is important and will help you to get off on the right foot as you prepare for surgery, go through surgery, and then recover from surgery. Now, the most important question with a partial knee replacement is, what is the likelihood that after you've made a full recovery, you'll be glad you went through it in the first place? And here you can see the satisfaction rates from a study on patients who had a partial knee. And if you add up very satisfied and satisfied, what you get is 90%. So that means that 9 in 10 people will be happy that they went through the process after having had a partial knee. One obvious question you're going to ask here is that higher than the percentage from a total knee? Yes, it is. About 5% higher, and total knee is at 85%. And as knee replacement surgeons, we think that the reason for that is that preserving large portions of your knee as your own knee, as opposed to replacing the entire thing and only replacing a portion of it, allows the knee to feel a little bit more natural. Now, do I know that is the reason why the satisfaction rates are higher? No, I don't have one, so I can't answer that question, but it's what we think. And it's one of the reasons to consider a partial knee, is that there is that higher likelihood that after you've made the full recovery, you'll be glad that you did. And I think if you come into it with a goal and say that I'm doing surgery, I'm doing this knee replacement so that I can blank, then it gives you something that you can benchmark against and say, okay, I came into this for this reason. I wanted to accomplish this goal. And if I can get back to doing that, then I'll be happy. Rather than saying it hurts, and if it didn't hurt, then I'd be happy, right? People who say, if I could hike, then I would be glad I had surgery. If I could get back to getting on my boat because it's wobbly getting on and off the boat and I feel like I'm going to lose my balance, or gardening or biking or any of these things, it's an incredibly personal thing. What would motivate you to have a surgery? But I think that's the key, is doing surgery in order to get something back that you've lost because of your arthritis, as opposed to saying, well, it doesn't feel good right now, and if it felt perfect, then I'd be happy. So as you're working through that process, I want you to think about this. I want you to think about what would make it worth it to go through this recovery if I could do it at the end. And when we get to the end of the process, I like sharing that with my patients. I love it when people come back and tell me what it is they're doing now. Show me pictures from their hike. Show me pictures of themselves playing with their grandkids, or whatever it is that motivated them to go through this in the first place. Because I think it's getting those things back that results in you being satisfied with having gone through it in the first place. I referenced earlier that you can do more, you can have a higher level of function with a partial knee than a total knee. And this is really powerfully underscored of Lindsey Vonn, who is a Olympic level skier who has actually gone back to competitive skiing after having had a partial knee. And you can see here Lindsey in her hospital room the day of her surgery, and then her x-rays there. Now, after a total knee, I do allow people to go back to skiing, and the evidence shows that people are able to get back to skiing. But I wouldn't anticipate that somebody would be able to get back to high level function like competitive slalom skiing like Lindsey Vonn was able to do on a total knee. And so this is, again, one of the benefits that we potentially have with a partial knee, is that possibility of a higher level of function, although we are trading for it a higher risk of having additional surgery on your knee down the road. there is a trade-off for the higher satisfaction and what we assume is the higher level of function with a partial knee, which is that unequivocally you have a higher risk of additional surgery on your knee from a partial knee as compared to a total knee. And here you can see from the American Joint Replacement Registry, which assembles the data from a lot of the joint replacements that are done in this country, that there's clearly a higher risk of further surgery on a partial knee. One of the challenges here is that it's much easier to turn a partial knee into a total knee than it is to revise a total knee. And so a lot of patients who come in having had a partial knee that they're dissatisfied with can then be converted to a total knee. And you can kind of find something wrong with it in order to justify doing that. But the data is very conclusive that the risk is higher. And so I think that that means before we do a partial knee, we should make sure that you're not going to be at high risk for needing conversion to a total knee. And there's two things that I do to try and minimize your risk of needing to be converted to a total knee from a partial knee. The first thing that I do is I get an MRI. And the MRI is not to look at the bad part of your knee, it's to look at the good part of your knee. Because if we get in on that MRI and we see, ooh, this knee is actually more worn out in the portions of the knee we thought were the good part, we should just replace those two. We should do the total knee. The second thing that I do is I use a robot to assist with the surgery during the partial knee. And the reason is that we want to make sure that the stress of your knee is going through the portion of the knee that was worn out and that we're replacing. We don't want to put all of the stress of the knee through the good part that we're trying to leave alone and allow to last forever. And using a robot helps me put a knee in so that I can ensure it remains slightly crooked, and I don't actually intend to make them perfectly straight because I want that stress to go through the portion of your knee that's already worn out, not the portion of your knee that I'm trying to have last forever. In an attempt to help you understand these statistics where we see the higher risk of additional surgery after a partial knee compared to a total knee, I wanted to include a quote from a paper from some surgeons out of England that talked about why we see these results. And what they said was, the consequence of it being easy to revise is that the threshold for revision is lower. As a result, the revision rate is higher, even though the chance of getting a poor result is lower. And what they're getting at here is that because it's very easy to cut off a partial knee in the process of doing a normal total knee, we have a lower threshold for suggesting that to patients who are dissatisfied with a partial knee, as opposed to a total knee, where it's very difficult to take out a total knee and revise it. And so because of this, because of that lower threshold, that may be why we see the higher revision risk. However, the data is very clear, and so I think it underscores the importance of making sure if we're going to do a partial knee, that you're not going to be at high risk for a conversion to a total knee later down the road. And that means making sure that the rest of the knee is in good condition before we do a partial knee, and making sure that we set your knee up so that the stress is going through the partial knee implant and not through the good portions of your knee that we're trying to leave alone. Obviously, a joint replacement is a big surgery, and one of the things that you want to make sure you're aware of as you're preparing for it is what the risks are. And a lot of times when people think about risks from a major surgery, what they're thinking about are things like a heart attack or a stroke or a blood clot that goes to your lungs, which is known as a pulmonary embolism. And you can see here that the risk of all of these things is very low, but they do happen, right? And that is something that we'll touch on later on in this series. We want to make sure that you are in the best medical condition possible to minimize the risk of all of those sorts of things. And if there's any benefit to delaying surgery so that we can further optimize you from a medical perspective to make sure that we're minimizing the risk of something catastrophic like that as much as possible, we'll work with your primary care doctor to do that, to make sure that we're giving you the safest surgery possible. But here you can see for this type of surgery, what the actual risks are. Obviously, these depend a lot, though, on underlying medical conditions. And again, that underscores the importance of working through an optimization process to get you in the best condition possible before we do your surgery. As we prepare for surgery, as I referenced previously, the number one thing that you can do to set yourself up for success is make sure that you're in the best medical condition possible. And this is a team approach that will involve myself, the rest of my team here at Island Orthopedics, and your primary care doctor. And this is very tailored to whatever your medical conditions are that you have in addition to your hip or knee arthritis. As a component of this, we'll get labs on you, we'll get an EKG, and we'll want to hear from your primary care provider if there's anything that they think should influence the way that we work through the surgery process with you. Additionally, if there are any specialists that you see, we may want to hear more information from them so that we can tailor a plan that meets your specific medical conditions. As you prepare for surgery, I also want you to make sure that your body has all of the things that it needs to recover from the surgery. Now, of course, I want you to eat a healthy diet, and you can see here from myplate.gov the general recommendations for what should be on your plate when you're eating dinner. As we prepare for surgery, there's a few other things that I want you to do to make sure that your body has what it needs in order to recover. The biggest thing is I want you to make sure that you're getting a lot of protein in your diet. And we actually check these levels in your blood before surgery to make sure that you do have enough to heal the wound and to form the scar around your joint replacement. But I want everybody to be getting lots of lean meats, and in some situations, people will choose to supplement their diet with some sort of protein or amino acid supplement in the lead up to surgery. And if that's something that you're interested in doing, we can talk to you about what some of those options are. The big thing is, if you're going to supplement protein in the lead up to surgery, I want you to make sure that you're doing it without getting a ton of additional sugar in your diet. We don't want you to be just getting a massive carb load in addition to the protein that you may or may not be supplementing with in the lead up to surgery. Another one that I want you to do is I want you to limit your sodium intake. After surgery, there's a massive increase in the amount of blood flow that goes to the area where you've had your joint replacement as your body is healing. And this brings a lot of fluid into the area. And we want to limit the amount of swelling as much as possible. And one of the things that can help with that is a low sodium diet. So as you're getting ready for surgery, this is not the time to be adding extra salt to your food. Again, something that will help with the swelling, which is going to be one of the big things we focus on in the recovery process. The last nutritional thing that I want to make sure we have in good condition is vitamin D. And we check these levels on you before surgery. If I pick up that those levels are low, I will send you a prescription for prescription strength vitamin D. But generally speaking, here in the fog capital of the world, most of us run on the lower end of vitamin D. So it's not a bad idea, even if you are not deficient in vitamin D, to supplement that as we prepare for your surgery. There are a few medical conditions that if you have them, we will definitely want to get them under control before we move forward with surgery. The three most common are smoking, poor diabetes control, and obesity. As it relates to smoking, if you are a current smoker, we will need you to quit before we move forward with surgery. I'll be happy to help with prescriptions or work with your primary care doctor to get you set up with management strategies that can aid you in quitting smoking, because I recognize that can be incredibly difficult. But it is a necessity, and we can't move forward with an elective surgery until you've quit smoking and we've taken a blood test that confirms that you have. Additionally, diabetes control is a very big risk factor for medical issues or surgical complications after a total joint replacement. And so if your hemoglobin A1C is too elevated, we will want to work with your primary care doctor on adjusting your diabetes medications to ensure that we get that lower so that we can minimize your risk for complications before we move forward with the surgery. The final thing, and this can be a tough conversation to have with patients, can be obesity. There are some situations where I will advise patients that it is in their best interest to lose weight before we move forward with the surgery in order to minimize their risk of complications afterwards. Obviously, these are very delicate conversations, and I want to make sure that you don't feel like you're left hanging and just told to come back when you're skinnier if you fall into that situation. I want to work with your primary care doctor or with weight loss specialists to try and make sure that you have the resources to work through that process so that we can navigate together to the finish line, which would eventually be a joint replacement. One other thing that we will screen you for and may talk to your primary care doctor about treatment strategies for and lead up to surgery is depression. And this may sound a little bit odd because we're talking about something that's very physical, but we need you to be in the best mental condition possible to engage with your recovery and work with physical therapy after the surgery. And when you have arthritis, we can get into a vicious cycle where arthritis causes pain. You do less because of your pain, so you're inactive, and then you get depressed. And the depression comes because you're experiencing chronic pain and you're not doing the activities that you enjoy because of your arthritis. And those can really feed off of each other, where the arthritis makes the pain worse, it makes the depression worse, it makes the inactivity worse, and some people can end up in a little bit of a cycle. And so if that's you, we'll want to work with your primary care doctor to devise a treatment strategy for the depression, along with our treatment strategy for your arthritis, so that we can ensure, both from a physical and from a mental perspective, you're ready to move forward with your recovery as soon as we get done with your surgery. Obviously, after surgery, we're going to want you to do a lot of exercise. That's where you kind of take things over from us and work with your physical therapist to really drive your recovery forward. The more exercise you can do in the lead up to surgery, the better it will equip you to hit the ground running afterwards. Now, the challenge here is finding that balance between what you can do without causing pain and what will be beneficial for you, right? If you had the ability to do all of the exercise you could ever want, you probably wouldn't be going through a joint replacement in the first place. And I kind of think of this like a ladder. Like, the higher you are up on this ladder of exercise, the more beneficial it will be for building muscle and for building cardiovascular endurance, but it's also going to be more likely to hurt. And so the top of the ladder is running. Running is a great exercise, but most people with arthritis find that that's very challenging. As we move down from there, we get to hiking. And many people with arthritis find that they can hike uphill, but not downhill. And so unless you find a place with a slide, it's going to be challenging to do that. Moving down from there is walking. And walking on flat ground is a very good option. And I find that's where a lot of people kind of level out at as they're preparing for surgery. A step down from walking, and this is surprising to a lot of people because it's a more strenuous exercise, is biking. And so because biking doesn't involve the contact of your foot on the ground, it can be less likely to exacerbate your arthritis pain as you're getting ready for surgery. And so some people who've traditionally walked may transition either to a bicycle or to an exercise bike as they're getting ready for surgery. And it can also be a very valuable tool during the recovery process as you're trying to get back on your feet. And then the last thing on this ladder is pool exercises. Pools are great because they eliminate your body weight from the movement on your joints. And so if you are able to get into a pool and move around, you may be able to do movements that are not possible for you when you're just out in our normal environment. And so for some people, as they're getting ready for surgery, they are kind of restricted to just the pool, but it still allows them to keep moving and keep their muscles as strong as they possibly can be as we're getting ready for that recovery process. If you are in a situation where you're only able to do pool exercises, I have here on the screen a few resources for local areas where you can go to get access to those. In particular, the Fidalgo Pool here in Anacortes and the YMCA in Mount Vernon are two places that offer pool exercise classes where you could go to engage in those. And if you know of other places, please tell me, because I'm always on the lookout for more. So that concludes this first video. I'd like to thank you again for trusting me to do your surgery, and can promise you that as we're working through this process, I'm working hard to make sure that I can do the best job possible for you. Moving forward from here with this educational series, the next video is going to be more focused on the logistics of the day of surgery and your early recovery. My intention is that you would watch that one after the surgery is scheduled and you have a date picked out. And we're starting to formulate concrete plans about moving forward with it. The reason I've broken it up like this is that all of a sudden, right before you have this surgery, you're going to be very focused on one thing and one thing only, which is, hey, this is going to hurt. What are we going to do about that? And that's largely the focus of that next video. It's more on short-term considerations as opposed to the long-term considerations that we talked about in the video today.